everybody, my presentation is on iron deficiency anemia. My name is Lizeth Castillo. So what causes the disease? As the name implies, iron deficiency anemia is caused by insufficient levels of iron in the blood. So without enough iron, the body isn't able to produce enough substance in our blood that allows for the transporting of the oxygen, otherwise known as hemoglobin. Now, some other causes of the disease can be attributed to blood loss, the inability to absorb iron, and that is most commonly seen in celiac disease, and we'll be going over that later on in the presentation. Another cause is pregnancy or internal bleeding and ulcers. Now, some prehistoric cases of anemia were found when human skeletal remains had small holes in the compact outer bony layers of the skull. So this often happens as a result of anemia. So we know that even back then, anemia was happening. Now some symptoms, just really quickly, I have them all listed here, but I will just go over the most important few. They would be extreme fatigue, weakness, pale skin, chest pain, fast heartbeat, or shortness of breath. And a lot of other people do experience headaches, dizziness, or lightheadedness. The ones listed after those are, they're not as common as the ones that are on the first few. So we would see the first 1, 2, 3, 4, 5 most commonly in comparison to the others. Now, what is the mode of transmission? Well, this disease cannot be spread through contact. Like I said, this is an internal disease, meaning that it is due to the lack of iron in our blood. Now, some things that can increase the risk factors are people who frequently donate blood, being pregnant or being a woman, and partaking in menstrual cycles, and an infant or a child who may have been born prematurely. Now, what are some treatments that we now offer? So, iron supplements are the most common replenishing factors that we do see nowadays. It comes in the form of a pill, and patients are told to take it on a daily basis. And as they take this pill, their iron count will go up. And so when they go back to the doctor, they're then again tested to see if their hemoglobin levels are leveling off as they are supposed to. Now, other treatments include oral contraceptives, such as birth control. Now, birth control regulates the cycles that a woman produces during her monthly menstrual cycle, so contraceptives are able to regulate that. And surgeries to remove ulcers or to close internal bleeding. Now, iron deficiency anemia is seen in cases of internal bleeding. That's when someone doesn't know that something may be wrong inside of them. So, like I said previously, someone may get really dizzy and faint, and they'll be taken to the doctor, and they'll figure out that they have some kind of internal bleeding going on. So that's how they figure out that that person has iron deficiency anemia at that point. Other treatments include eating foods that are also rich in iron. Those include lean red meat, chicken and fish, rice, bread and pasta, and a lot of other foods. Now, current research being done is the correlation between celiac disease and iron deficiency anemia. Now, because people with celiac disease are not able to absorb gluten in their intestinal tract is being damaged. Now, their intestine is unable to absorb nutrients needed from the food that we consume. So, something that is being done is they are seeing if gluten-free diets are really necessary to heal the small intestine. And here are some references. Thank you for watching my presentation.